रागादिरोगान् सततानुशक्तानशेषकायः प्रसृतानशेषान् औत्सुक्यमोहारतिदान् जघान यो पूर्ववैद्याय नमोऽस्तु तस्मै. In the previous episode, we had just started about Vamana, Virechana, Vyapat, Siddhi, and main references we had taken from Charaka, Siddhisthana. So today we will continue the topic from here. We will just revise what and all we learned in the previous session, and then we will move on to the further topic what we have to take today. Okay. So, all the precautionary measures must be taken to avoid any complications. So, meticulous care is important for saving the patient's life. So, the emergency drugs must be collected before conducting any procedure of the Panchakarma. And here we are speaking about Vamana and Virechana Vyapat. So, any emergency drugs that may be needed at the time of the Vyapat have to be collected beforehand without any emergency management, not supposed to administer any drug for the procedure. So whenever you want to set up a clinic where you are going to perform Vamana and Virechana or any other Panchakarma procedures, please do make sure that you have every other emergency management drugs which are needed. Okay, so proper Snehana and Svedana must be done for the clearance of the dosha from the body before Vamana and Virechana. This we actually understood very clearly in the previous session. Then to assess the sign and symptoms, observe the patient during the Shodhana Karma. This also we have to do. And at the end of that Snehapana stage, we will be administering the Vamana or Virechana medicines. So as how the patient responds to our treatment during the course of Snehapana, we will be administering the patient with what is the quantity and quality of the aushadha, the Vamana or Virechana aushadha that we have to give to the patient so that we can avoid or prevent any Vyapat from happening in a later stage. Okay, these are all the precautions we take, and these are the observations that we have to make. Acharya Charaka, as told in the previous session only, Acharya Charaka has explained 10 Vyapat of Vamana and Virechana Karma with detailed description and their management. Before getting into the topic specific of those 10 Vamana Virechana Vyapat, we understood something which comes before the curtains, right? That is like talking about the Vamana Aushadha resulting in Virechana, or sometimes when Virechana Aushadha result in Vamana. Then we spoke about how many Vyapats have been mentioned by different acharyas. Then we understood what is exactly Ayoga, what is Ati Yoga, right? So in Ayoga, we explained 3 to 4 points. Then we understood if at all we have given the Aushadha, but it can get into two process. One is it can get digested. The other thing, it has not digested. So at these two stages, what has to be done? What is the management further? So when the Aushadha is administered, but there is no proper Shodhana. So what should be done at that stage? If it is digested, then we have to administer the Aushadha once again. If it is not digested, then medicine concealed inside, then don't repeat the administration. There is the bhaya of Ati Yoga. These are a few possible things that we understood. Then, Aushadha administered, but there was no proper Shodhana, but still there was, if it was digested. Now we have to administer the medicine. What kind of medicine we have to give? We have to assess whether it should be Mrudu or Tikshna. We have to assess the Koshtha, Guruta and Laguta. We have to understand the Koshtha Bala. Why this Koshtha is so much important? And it is gaining so much momentum in the research field today, in the field of biochemistry or in the field of functional medicine. Speaking about this, they speak a lot of something called as gut microbiota. I hope you guys are aware of this. So gut microbiota is a vast and complex collection of microorganisms that profoundly affects the human health. Okay, so previously people referred to the gut microbiota as microflora of the gut. The gut microbiota assists in a range of bodily functions, including harvesting energy from the digested food, or it is protecting against the pathogens, regulating the immune function, strengthening the biochemical barriers of the gut and the intestine. So changes in the microbiota composition can affect these functions, which I described previously. So while there are beneficial bacteria in the gut, there are also harmful bacteria that can enter the GI tract and cause infection. These infections include the food poisoning and other GI diseases that result in diarrhea and vomiting. Okay. Why is that human microbiota so much important, and why Ayurveda always considers the assessment of Koshta as a very important pariksha before giving any panchakarma? I'm not here correlating exactly that Koshta, the knowledge of Koshta is exactly the knowledge of gut microbiota. No. I'm just saying the modern research has now found it has kept a baby step in understanding the Koshta, right? They might have not termed it as Koshtha, but they might be, and for now they are terming it as gut microbiota. What is the behavior of those microbes there, which are harmful, which are useful? These can give us a little information. That means it's an introduction to the Koshtha way of thinking, but by understanding the human microbiota, right? So they have come up with this theory of how the bacterial population makeup and potential differences which can link to causing asthma, autism spectrum disorder, cancer, celiac diseases, diabetes, eczema, all these. They have come up with different research techniques where they could understand what difference in the gut microbiota can cause asthma, what changes in the flora of the gut can cause eczema. These are some researches that have come up. So now we can understand why Ayurveda always targets not just the external therapy as such, but the internal therapy, and it gives so much of importance to the Panchakarma. And in that Panchakarma, why Vamana and Virechana are so much important, and why Koshta assessment is important, right? So why the Koshta assessment is important? Why? Because it actually influences more on the koshtha. It influences more on the gut microbiota. That is why this koshtha assessment before any panchakarma is important. Why? One more reason to this, we understood that any disease is because of it generally starts from the amashya or the pakvashya or the pachamanashya. Every disease starts here. So if we want that person to get into the healthy stage, we have to target this area only. How the modern research is now coming up with the newest theories of understanding gut and its flora and its effect on causing many diseases. Ayurveda has understood this long back. So both for health, and if at all any changes is happening and causing a disease, we have to focus on koshtha itself. This we understood in the previous session. That is why we give so much of importance to koshtha bhala and the behavior of the koshtha before assessing or before determining what is the sneha pana quantity, which kind of sneha to be given, whether it should be a grita, taila, and many such things. And also while administering the vamana and virechana aushadha, we understand that koshta is to be given that importance. It can be a mrudu koshta person, madhyama koshta person, krura koshta person. So in all these cases, the assessment is different, and the amount of medicine which is given is different, right? Further moving on, we also understood when not to repeatedly administer the aushadha. Then Vyapat, because of the Aushadha administration without any proper Snehana and Svedana, if it is done, what and all it can cause. So, Tamaso Darshana, Hikka, Shvayatu, Vibramsha, Pindikodveshtana, Kandu, Urusada, Vivaranata. These are all the things that can happen. Then we understood there are 10 Vamana Virechana Vyapa that has been explained by Acharya Charaka. आध्मानं परिकर्तिश्च स्रावो हृद्गात्रयोर्ग्रहः जीवादानं सविभ्रंशः स्तम्भः सो उपद्रवः क्लमः. In this there is a division which comes under ayoga, which comes under atiyoga, right? So admana, srava, hridgaha, gratragraha, stambha, upadrava, klama, all these come under ayoga. While in the Ati Yoga, there is Parikartika, Jivadana, and Gudabramsha. Hope you remember this point, because further we will be moving on into individual explanation of Adhana, Srava, individual explanation of Hudgaha. So at that time, we should not forget this point, whether it's an Ati Yoga or whether it's an Ayoga. Okay, always keep this in mind. Parikartika is the second Vamana Virechana Vyapat. Jivadana is the sixth Vamana Virechana Vyapat. And then the Bhramsha comes. Okay, Savib Bhramsha, the seventh one. So these three things come under Ati Yoga, while the rest of them come under Ayoga. The meanings of them we understood. And in Vibramsha, we also have three other points. One is Gudabramsha, other one is Sangna Bhramsha, then Kandu. All these come under Vibramsha only. Now we will start with the topic Adhana. We will understand Adhana. In every Vamana Virechana Vyapat, we have three things to understand. Okay. What are those three things? One is Nidana, the second one is Lakshana, and the third one is Chikitsa. I repeat, every Vamana Virechana Vyapat has a Nidana, every Vamana Virechana Vyapat has a Lakshana, and then every Vamana Virechana Vyapat has a Chikitsa, its own Chikitsa, right? Some influencing diseases might be taken here, saying, like in some Vamana Virechana Vyapat, Udavarta like treatment has to be done. In some Vamana Virechana Vyapat, Arshas or Grahani like treatment has to be done. These are there. It's not like Vamana Virechana Vyapat has a set of its own treatment. There are some simulating or mimicking kind of lakshanas which are resulted because of Vamana Virechana Vyapat. There we have to take the principles of those diseases and their treatments as well. Okay. So Adhana. Now coming into the Adhana. Karana. There are some Karanas. That means to say the Nidana of Adhana. Why? Which kind of Vamana Virechana Vyapat or what condition of the patient while taking Vamana Virechana Vyapat can lead to Adhana. So Adhana is the main symptom, while it has some Nidanas. What are those Nidanas? There are 5 Nidanas. If patient had Bahudosha, if patient is suffering from Rukshata, if patient has Hina Agni, if the patient is suffering from Udavarta in its beforehand, or if he is administered with Alpa Aushadha. He is a Madhyama or Krura Koshta person, but I have administered him Alpa Aushadha. What happens at this stage? It can lead to Adhana. Okay. Further, see, while we understand this, generally what we do, we don't get into the depth of understanding of what is Bahudosha, Hina, Agni, Udavarta, Alpaushada, and such things while speaking about Vamana Virechana Vyapat. But what we have to give importance here, we have to go back to the references where these Bahudosha, Hina, Agni, and all have been explained and come back again to Vamana Virechana Vyapat so that we can make a conjunction and understand why Bahudosha is causing Adhana, why Hinagni is causing Adhana. So I have given the references here. Please go back and refer. Bahudosha is explained in Charaka Sutra 16. Hinagni is explained in Charaka Chikitsa 15. Udavarta in Charaka Chikitsa 26 and Alpaushada in Charaka Siddhi 6th chapter. Okay. Go back to these references and then understand once again why these are causing Vamana Virechana Vyapa. Then, okay, further, one important thing here is Udavarta. In Nidana also we get Udavarta, and while explaining about the Chikitsa of Adhana also we get the explanation of Udavarta like Chikitsa. What are the Nidanas of Udavarta? Kashaya Tiktoshana Ruksha Bhojyaihi Sandharana Bhojana Maithunaischa. So one is Ahara related, the other one is Vihara related. Kashaya Tikta Ushana Ruksha Bhojyehi. Other, the Vihara is Sandharana, Abhojana, Maithuna. These are all related to the Vihara. Samprapti. What happens here in Udavarta? Pakvashaye kupyati shed apanaha. We know apana, the site of apana is Pakvashaya. There, what happens? Pakvashaye kupyati. Apanaha kupyati. That means to say there is kopana. Then srotamsi adhogani balisa ruddha. So what it does, it causes rodhana or obstructing the adhogami srotas. What are all the srotas that comes below the navi? It tries to obstruct those pathways. This is the samprapti of Udavarta. So what Lakshana do we get generally? Karoti Vinmaruta Mutra Sangam. So this we understand. Some patients come up with the complaint of, I don't feel the urge to pass urine. Right? When you start seeing the patients, actually they come to Shalya OPD sometimes. At least in my college, I used to see them there. Okay. So Krama Dudavartam Adah Sugoram. What and all other things happen? Ruk. Where and all the ruk, the pain can happen. Basti, Hrit, Kukshi, Udara, Prushta, Parshva, Ati Daruna Ruk, Abhikshnam Ruk can happen. That means to say it happens repeatedly or it comes in much severity, the pain. Then it results into adhana hillasa vikartikascha todo avipakascha sabasti shotaha. It can also cause basti shota. See, in Ayurveda, we always think, okay, while I was understanding the modern textbook, there was inflammation of bladder, there was infection of bladder, there was cysts in the bladder, neoplasms of the bladder, all are explained under one chapter. But here in Ayurveda, I don't get it like that. Why? Some anatomical features or pathologies related to basti is given elsewhere, and physiology related diseases are given somewhere, and some other idiopathic causes related to the disease are given somewhere. So it is just that they're explained in a functional way. Here it is not explained an organ, a lesion, a disease. They have not explained like that. Ayurveda has, as far as my understanding is concerned, it explains in a functional way. Where and all such karmas have been explained, such kriyas have been explained, that kind of disease is explained in such a such context, right? Here you can see Basti Shota. Here you are seeing Basti Rukka. These are explained under Udavarta because functionally it is more related to Udavarta. Functionally it is more related to Apanavata. That is why it has been explained here. But in a different context, Mutraghata, Mutrakrichra, the 13 types of Mutraghata have been explained. So it's a different context in itself. Both are related, but Basti has been taken in a different context while the function of Mutra Pravrittis has been taken in a different context. So, though we are on the talks of Vamana Virechana Vyapat, I just wanted to highlight this. Basti Shota, Basti Ruk has been explained here. So now you cannot say that inflammation or any pathology related, the basic pathology related to Basti has not been explained in Ayurveda. It's very much explained under the context of Udavarta. Okay. Then there is Varcho Apravrittihi, Jatare cha Gandani Urdhvacha, Vayurvihato Gudesyat. All these have been explained in Udavarta. I'll not get into the details. We can talk about these when we actually explain about Udavarta. I just wanted to bring these shlokas into your notice. Why? Because the Vamana Virechana Vyapat Adhana is the first one, and how exactly it is correlating to the Lakshana and Samprapti of Udavarta as well. The connection between them I wanted to highlight. That is why I have presented this shloka over here. Okay. Then what happens in the Adhana Vyapat? What is the Lakshana of the Adhana Vyapat? Margan Nirudhya Doshan Utklishya. What happens here also exactly like the Udavarta? Margan Nirudhya, obstructing the Marga, Doshan Utklishya. Two things happen. One, obstruction to the Marga. Other one, there is Utkleshana of the dosha. What happens? Basti Pradesha, there is Adhana. Remember, it is not the whole generalized abdominal swelling, right? Exactly in the Basti Pradesha, there is Adhana. Then Prushta Parshva Shiroruja, gut brain axis. We have been in the times of, I mean, in the present times, we are actually speaking more about gut brain axis as well. Why Vega Avarodha is given so much of importance in Ayurveda. How Shiroruja will happen because of Apanavata Dharana or I mean the Adho Vata Dharana or because of the Purisha Dharana. Why exactly Shiroruja happens? You can go back to Guyton Physiology also to check out this. Okay. So Prushpa Parshva Shiroruja. Then Shwasa Vindmutra Vatanam Sangam. How to remember this? The whole idea of making this session is to how easily we can understand this, how logically we can remember this. all these points, right? So first thing you have to understand, Marga Nirodha is there and Dosha Utkrishya is there. To which part of the body is it related to? This Marga, now it's related to Basti Pradesha. Okay. What kind of Vega Avarodha is happening or what kind of Sangha is happening here? Vit, Mutra, Vata, Sangha. All related to Apana Vata will get into Sangha. Okay, Shvasa is little an exception, but in Shvasa also we can understand how Vatas, other five types of Vatas are related. Okay, Shvasa with Mutra Vatanam Sangam. What it leads to? Gut brain axis. Think of that. You can understand Adhana in Basti Pradesha, and also then you can understand with the brain axis Shiroruja. Prushta, Parshva, Shiroruja. Three things. With Mutra Vata Sangha, other three things. Okay. Then we will talk about chikitsa. So when there is sangha, what you have to do? You have to do the abhyanga and sweda at first. If at all, then also the mudra and vata with sangha is not releasing. What you have to do? You have to give a suppository. You have to do the varti prayoga. That's the second stage. Okay, I'll give an example of I mean the urinary retention of the urine. Okay. If the patient comes with that, what is the first thing we can do? We have to make sure there is no rupture or there is no infection as such. Then we have to understand the cause of retention of urine first. Then what we can do? We can do Swedan and Nabhi. Over the Nabhi, we can do Snehana, Svedana. Okay. If it doesn't work, along with that, we have to give Varti. Then what is the next stage? Giving the Basti. If the Varti is not working, higher stage we have to treat again. So Niruha and Anuvasana. And all treatments that are mentioned under Udavarta can be put into good use when the Lakshana is Atmana. Okay. I hope you can remember it in a good way now. So Karana, there are five. Lakshana, there are four, and Chikitsa, there is two. What is the Karana? Bahudosha, Ruksha, Heenagni, Udavarta, and also Alpaushadha. If Alpaushadha is given in these conditions, if patient had Bahudosha, Ruksha, Heenagni, and Udavarta, and we are giving Alpaushadha, what happens? Okay, this is the whole idea. Then what is the Lakshana here? Again, it's four. We can remember the Karana also exactly as four only. When we are giving Alpaushadha in four conditions, Bahudosha, Ruksha, Heenagni, Udavarta, it causes four Lakshanas. Margan Nirudhya Doshan Utklishya. Second one is Adhana in Basti Pradesha. Third one is Ruja, which is related to Prushta Parshva Shiras. Then there is Sangha related to Vit Mutra Vata along with Shwasa. Okay. Then Chikitsa, we understood Abhyanga Svedana first stage, second stage is Varthi, third stage is Basti, both Nirubha and Anuvasana. And fourth one, all treatments mentioned under Udavarta. So I hope you can understand all things in four Karanas, four Lakshanas, and four Chikitsa, four level of Chikitsa. So what exactly is the general treatment of Udavarta then? ತೈಲ ಪ್ರಯೋಗ ಸ್ವೇದ ಪ್ರಯೋಗ ವರ್ತಿ ನಿರೂಹ ಬಸ್ತಿ ಪ್ರಯೋಗ ವಿರೇಚನ ಪ್ರಯೋಗ ಅನುಲೋಮನ ಅನ್ನ ಪ್ರಯೋಗ ನಾಡಿ ಅಥವಾ ತತ್ ಪ್ರಥಮೇತ್ತು ಚೂರ್ಣಂ so churna prayoga can be done. So I hope now you can understand what exactly is the connection between adhana vamana virechana vyapat and also udavarta. The treatment and the lakshanas are so similar, that is why the general treatment of udavarta can be done in the case of Adhana Vyapat also. Okay, moving on. Second one is Parikartika. Today we will be dealing with five. In the next class, we will be dealing with the other five Vyapats. Okay, so this is the second Vyapat for today. Kartanavat Vedana, that is sawing pain in the abdominal region or the lower abdomen region. Upper or lower abdomen region is Parikartika. So what are all the Nidanas? First condition. There are two conditions here. Okay. Parikartika is the second Vyapat. And here there are two conditions. One, if the patient is Nigdha, is Guru Koshtha, and is Sama, in Sama condition. And the second condition is if the patient is Kshama, Mrudu Koshtha, Shranta, and Alpabala, all the negative things, and all the, upper side is on the first case, lower side is on the second case. So there are two scenarios. Parikartika is the second Vyapat, and there are two scenarios. How? If a patient is Snigdha, Guru Koshta and Sama, in that patient, if Balavat Aushadha is given, then in Kshama, Mrudukoshta, Shranta, and Alpabala patient, the fast acting medicine is given. In these two conditions, Parikartika can take place. Okay, I hope you can remember it easily now. Parikartika is the second Vyapat and it has two scenarios. First scenario is on the higher side, that is all Snigdha, Guru Koshta, Sama. In him, Balavat Aushadha is given and too much Balavat Aushadha is given. And in Kshama, Mrudukoshta, Shranta, and Alpabala patient, fast acting Ashukari medicine is given. What happens at this stage? Lakshana. What are all the Lakshanas that can happen? Gudam gatva samam dosham nirasya cha tivra shulam karoti sapichasram virechanam karoti. And it results in parikartika. Why it is important? Okay, here we'll understand why there is Pichasra or why there is Tivrashula or why Samadosha results into liquidity. That means to say there is more liquid stools that comes out because of the Samadosha. Mucus barrier, mucins and the gut microbiota. The expected slimy partners. Okay, this is one article from PubMed. So, citing among them, the integrity of the mucus barrier is one of the first lines of protection of gastrointestinal tract. This we have understood. Like even when we were studying about immunity, the innate immunity, the natural immunity, in these cases, we had understood about the first line of protection. In that, GIT is also one. In the past, the slimy partner was mostly considered a simple lubricant for the facilitating the progression of the food bolus and stools in the gut. But now, what has happened? The role of the gut barrier has been studied for decades, but the exact mechanisms involved in the protection of the gut barrier are various and complementary. This the modern scientists have understood. Since then, different researchers have made important progress, and currently, the regulation of this mucus barrier is gaining increasing attention from the scientific community. Among the factors influencing the mucus barrier, so there can be many other factors also, no, for the mucus in the GIT to produce. In that, the microbiome plays a major role in driving the mucus changes. Additionally, our dietary habits like high fat diet, low fiber or high fiber diet, food additives, probiotics influence mucus at different levels. So, given that the mucus layer has been linked with the appearance of the diseases, proper knowledge is highly warranted. So, here we can understand why Vamana Virechana Vyapat is resulting into Gudam Gatva Samam Dosham Nirasyacha. Why there is so much of liquid stools? Because of that overproduction or overactivity of the microbiota, it may result into Tivra Shula or Sapicha Asram. It is sticky and bloody fluid that is coming out of the anus. Right? Why it is happening? It is all because of this underplay of the gut microbiota. Okay, I'm just connecting these two points. See, while reading about Ayurveda, of course, I highly respect only to read Ayurveda only. Then after that, we have to understand in modern terms how better we can understand it. How can we visualize what we are studying from the shlokas? These things also you have to take a keen interest on. So while I was doing that, I just got a connection between the microbiota as well as the explanations under Vamana Virechana Vyapat. So just gave a glimpse of it. Then high alterations in the mucus of the GIT and high altered gut microbiota can be suspected at this case. What is the chikitsa then? We had two things, right? Two scenarios were there. In Sama Avastha, Langana, Pachana, Ruksha, Ushna, Lagu, Bhojana can be given. So in Sama Avastha, what was the Nidana? Snigdha, Guru Koshtha, Sama, all these were the Nidanas. So contemporary to it, the counterpart of it, the medicine has to be given. So it is Guru Koshta, give Langhana. It is Sama, give Pachana. So it is Snigdha, so you have to give Ruksha, Ushna, Lagu Bhojana. Okay. In Kshama Rogi, what are all were there? Just try to recall. Kshama, Alpabala, Mrudu Koshta, Shranta, these were the Nidanas. So what should be the treatment in this case? All should be energy giving. Sarvaha Brahmaniyaha Vidihi, Sarvaha Madhuraha Vidihi in Kshamarogi. What type of Basti Prayoga has to be done? Pichasra has gone out now. So, contrary to it, you have to be giving Picha Basti in order to um, reproduce or re-establish the gut microbiota. Can you relate now? If I was just saying that there is Sama Avastha and there is Pichasra which is going out, you cannot relate to it. You cannot visualize it to it. That's why an example was brought in. Okay, high mucus production, high activity of the gut cells. If they overwork, they lose the energy. So in order to give them the energy and the stability for the proper production, Picha Basti has to be given now. Sneha Basti has to be given. I hope you are getting the connection now. Why Parikartika? What is the Nidana? Why such and such Lakshana? And why the Chikitsa like this? There's a logic to it. How beautiful Ayurveda science has explained it. Can you understand now? What was the higher altar of the research that they had at that time? Now we might be coming up with researches on a black and white paper, but the content, what they had at that time, was really very high. Okay, third one is Parisrava, discharges. Nidana related to it. Okay. I hope you remember which are the Ayoga Vyapat we discussed until now and which are the Atiyoga Vyapats. I hope you remember. Parikartika was the Atiyoga Vyapat. Okay. And these two, Adhana and Parisrava, are Ayoga Vyapats. Okay. Alpa Beshaja given to the person who has Bahudosha. What happens here? The patient has Bahudosha, but we are giving only little quantity of medicine. Utklishta dosha, dosha is still in the Utklishta Avastha only. There is no much medicine which was given at proper quantity to take it out, to eliminate it out. That quantity of medicine is not given. So what happens? Alpa alpam sravayet. So it keeps discharging now and then, but proper quantity of elimination is not happening because there is more dosha in the body than compared to the medicine that is given. Okay. So at this time, what can be the two chikitsa that can be done for the Parisravi Vyapat? It can be treated in two ways. One, Shamana can be given, the other, Vamana can be given. So first, Nehana has to be done or Tikshna Virechana has to be given. So if the patient was indicated for Vamana, but the Vamana is not happening properly, you give the Vamana again. If the patient was indicated for Virechana, then at this time, Snehana and Tikshna Virechana has to be given. After that, we have to prescribe churna or medicine in the form of asava arishta as like given in arshas or grahani chikitsa. So this is the second reference of the uh, vyadhi related chikitsa taken in vamana virechana vyapas. The first one was in adhana udavarta chikitsa was done, and here in the Parisravi Vyapat, Arshas or Grahani like Chikitsa and the Churna Asava Arishta related to it can be utilized. What are all the Lakshana related to the Parisrava? 8 Lakshanas are there. Okay. Kandu, Kushta, Srava. Okay. Where there is Srava, what and all can you remember? At first you can remember Kandu and Kushta. Okay. Then there is Panduta and Shopha. Shopha and Pandu are related diseases. I hope you remember how Shotha and Pandu have explained in Nidana Sthana of Ashtanga. They are explained in a single chapter. Okay. Because they are always related. Shotha and Pandu. That can also be related to the inflammatory fluids. Okay. Parisrava, you can one think of Lasika like giving rise to Kandu Kushtha. Other one is the intracellular or extracellular fluid like that is also Srava, which is related to Shopha and Pandu. Then Aruchi and Agnibala, if proper amount of acids or alkalines have not been produced in the body, it can be related to Aruchi and Agnibala. Okay. Then the final one is Gaurava and Staimitya. So there are 8 Lakshanas which are related to Parisravi Vyapat. Moving on, we have Hridgraha. Okay. Stiffness in the cardiac region or difficulty or spasm. What happens in Hridgraha? First, we will understand the Nidana. Okay. Pita Ushadhasya. The patient has taken the Aushadha now, but what he is doing now? Vamana and Virechana Vegas are coming, but he is actually suppressing it. This happens in Hridgraha and also as well in Angagraha. Okay, just remember the word Graha. In that, what patient does, he or she has taken the medicine, but the Vega has also started generating, but they are suppressing it. Veganam Nigraha. Because of Vega Nigraha, what happens? You know what happens when there is Nigraha of Vega, right? Maruta. Maruta first it gets into Prakopa, and here all the doshas get into Prakopa. Marutadayaha Kupita. Okay. What they do, they go into Hridayam Gatva. Okay. What will all the medicines that you are taking will be digested or then the result on the Hridaya. Then they have their first effect on the Hridaya. Right? Rasadhatu sthana. Okay. So Hridayam Gatva Ghoram Hridgraham Kurvanti. Why? Because the patient has been administered the medicine and Vegas have also started generating. But what he is doing, he is suppressing it. At this time, what happens? There is more load on Hridaya. So, Ghoram Hridgraham Kurvanti. What are all the Lakshanas? So, I have made it into 5 parts. Okay, to easily remember them. Hikka, Kasa, Parshvarthi come in one distinction. Hikka related to Kasa related to the Parshvaruja. So, this comes under one. Second, Dainya and Nisangnata. Dainya is patient has such a, the expression is so low in his face, Dainyata. And Nisangnata, he might become unconscious also. Okay. Then there are related to sense organs. What are they? Lalakshi Vibramaihi. Then Jivham Khadati. Dantan Kitikitapayan. So these are like shock-like symptoms. Hridgraham getting into shock-like symptoms. At that time, the patient can bite his own tongue. The patient does the sound of the teeth, like ramblings of the teeth, when there is more of anxiety. Why? Because anxiety is because of that Hridgraha. It is related to it is related to Manas. Okay. So Hridgraha is one such Vamana Virechana Vyapat. It happens because of suppression of the already generated Vamana or Virechana Vega. It relates into Marutadayaha Kupitaha, Tedosha Prakopa. Then it goes into the Hridaya, causes Ghoram Hridgraham Kurvanti. Lakshanas are 5 combinations. Hikka Kasa Parshvarti, Dainya and Nisangnata, Lalakshi Vibramaihi, Jivham Khadati, and Dantan Kitikitapayan. What can be the probable mode of chikitsa here? Ashu Vamayet. First, if at all the Vamana Vega was suppressing, if at all the treatment was Vamana, then you have to administer Vamana very swiftly. Then, if the patient faints, Nisangnata happens because of increased Pitta. Okay, then what we have to do? Give Vamana but with Madhura Aushadha. This principle you can also understand from the Kasa Chikitsa Adhyaya of Charaka Chikitsa 18th chapter. There also, if there was Pitta Jakasa, the Vamana has to be done with Madhura Aushadha. Go and refer. Then if it was Kapha, increased Kapha, then you have to do Vamana with Katu Aushadha. There also it is the same principle. Okay. Then the third principle of Chikitsa, what you can do, Pachana, Vipachana of the Shesha dosha. And Kayagni and the Bala has to be restored gradually. Can you relate? The Lakshana, Hikka Kasa Shvasa was there, Parshvarti was there, then you have to do Vamana, Ashu Vamana. If there was Dainyata and Nisangnata and the patient faints because of that, if there is increased Pitta, do Vamana with Madhura Aushadha. If there is increased Kapha, do Vamana with Katu Aushadha. Then Pachana, Vipachana of the Shesha dosha. If at all, even after doing all this, there is Shesha dosha, there is some remnants of the dosha, then you have to do Pachana. And again, you have to work upon Kaya, Agni, and Bala. Because of excess Vamana in Hridaya, two things can happen. Two ways of pathology can happen. What are they? In one, it can be related to Maruta alone, Pavana, that is Vata alone. In other case scenario, it can be Pitta and Kapha which are acting together. If at all, because of the excess Vamana in Hridaya, there is pain or Graha because of Vata, then Snigdhamla Lavanam Dadyat. That kind of food or that kind of medicine has to be given. If at all it was related to Pitta and Kapha, then give Ruksha, Tikta and Katu Aukshata. Hope you can remember now. Lakshana, Chikitsa related. Hikka, Kasa, Parshvarti was there, give Ashu Vamana. If there was Dainyata and Nisangnata, give Vamana with such and such Aushada, Madhura or Katu Aushada. Then Pachana has to be done, Agni and Bala has to be restored. If at all because of excess Vamana in Hridaya, there is more Vata Prakopa, give Snigdhamla Lavana, Aushada or Anna. Then if it was because of Pitta and Kapha which got vitiated, then you have to give Ruksha Tikta and Katu Aushada. Okay, now coming into the fifth one, that is Angagraha. That is generalized stiffness or difficulty or spasm of the body. Nidana. As I told previously, here also there is suppression of already generated Vamana or Virechana Vega. As like in Hridgraha, in Angagraha also. So, Pitaushadhasya Veganam Nigraha. What happens here directly? Kaphena va ruddho doshaha punar angani nigrahnati. Here it is not at a time the vata pitta kapha are not getting vitiated as like in hridgraha. But what is happening? The marga of the dosha chalana is being made a ruddhapata. That is an obstruction is there or the surrounding of that srotas has been done by kapha. Okay. Because of this, there is weakness in the body or there is stiffness of the body. Then the second thing what can happen, if at all the patient has undergone ati shodhana, like there is excess of shodhana in them, there is vata prakopa. At this time also kupito angani pratigrahnati. It can again hold or it cannot. What happens if there is more of ruksha guna? What happens? Think if there is more vata prakopa because of ati shodhana, then at this time there is more rukshata. What happens? This causes stambhana. If kapha is in excess, there is no chalaguna at all. At that time there is stambhana. Again, if there is more rukshata, at that time also there can be graha like symptoms, lakshanas. So stambha vepatu nistoda sadodveshtana manthanaihi. This is the lakshana of angagraha. Stambha vepatu. There can be totally, there can be stambha or there can be totally, there can be tremors. Vepatu. Opposites. Then nistoda and sada. One side it can be paining totally, other side it can be total weakness. Then udveshtana and manthana. The types of pain presentation. Then two chikitsa has to be done. One is sarvam vataharam vidhi. Second one is snehas with the help of snehana and svedana. This can be treated like sarvanga snehana svedana can be done and all vatahara vidhi has to be done. So I hope it was easy for you to remember. I'll just recall what and all we read today. So we spoke about Adhana. We spoke about the Karana. There were 4 Karanas. Udavarta being very important of them. There were 4 Lakshanas and 4 levels of Chikitsa. Among them again Udavarta related Chikitsa is very important. Parikartika was the second one. Here it is the second Vyapat. It is the Ati Yoga of Vamana Virechana. There are 2 case scenarios. One is Snigdha, Guru Koshta and Sama being administered with Bahu Aushada. Balavat Aushada. Then in the second scenario, Kshama, Mrudu Koshta, Shrata and Alpabala. Here the patient has been administered with fast acting medicine, even though his Koshta is not of that kind. What happens at this stage? Gudam Gatva Samam Dosham Nirasyaja. First it liquefies all the ama and 2 things can happen. One, it can cause Shula or it can be discharged like Sapit Shastra. In Samavastha, what chikitsa has to be done? In Kshama Rogi, what chikitsa has to be done? Again, Basti can be related to Picha Basti and Sneha Basti. In Parisrava, this is because of the Ayoga. Alpa bheshaja given to the person who has bahu dosha. So because of this, proper elimination and proper quantity of elimination of dosha is not there. It can be treated in two ways: Shamana or Vamana and Virechana. That means to say Shamana or Shodhana. After that, Arshas or Grahani related Churna Asavarishta has to be given. What are the Lakshanas? There are 8 Lakshanas. Kandu Kushtha, Shobha Pandu, Aruchi Agnibala Utlesha, Gauravam Staimitya. Fourth one is Hritgraha. Here the Nidana is because of suppression of the already generated Vega. Marutadayaha Kupitaha. Hridayam Gatva Ghoram Hritgraham Kuruvanti. 5 stages of Lakshanas. Related to them, Chikitsa is there. Then in the fifth one, Angagraha. Nidana is also, again here it is suppression of the Vamana or Virechana Vega. It can be related to the Srotas getting obstructed because of Kapha, which causes the Graha, Angagraha, or it can be because of Atishodhana, where there is Maruta Prakopa, that also resulting in Angagraha. So Stambha Vepatu, 2 extremes, Nistoda and Sada, 2 extremes, and 2 other presentations of pain, Udveshtana and Manthana. What is the Chikitsa? Sarvam Vataharam Vidhi and Snehasvedadi. Here at this point, I want to bring another topic into your notice when we were speaking about the gut microbiota. So Sneha Dvesha, why do you think the Sneha Dvesha actually happens? There is a certain lakshana of snehapana, samyak snehana called sneha dvesha. Why it happens? Sneha dvesha is because of the large amount of fats that is given during the snehapana that initiates the inflammation of the gastrointestinal tract. This is also again from a PubMed article saying this is actually this PubMed article is from a Ayurveda college only. Shivalik Ayurveda Medical College, Azamgarh, Uttar Pradesh. Here they have done a clinical study on Virechana Karma, therapeutic purgation over the gut flora with special reference to obesity. This is a article that has come up. So in that, while explaining about the results or discussion, they have said, since there is a carbohydrate restriction in the diet during the snehapana, because we are giving acha snehapana, ketosis is induced. Hence, in the process of snehapana, medically ketosis is induced. This can be explained as in the process of snehapana, the source of energy is changed to proteins to begin with and then to fat, thus inducing the ketosis. I think you all are aware of glycosis, gluconeogenesis in the liver. From where do we extract the energy? It can be because of carbohydrates, or it can be because of proteins, or it can be because of the fats. Generally, we take more of carbohydrates, right? The final thing which can happen is because of the fat. Okay, after the digestion, the excessive fat is lost in the form of stiterra. So, for the purpose of Shodhana Chikitsa, the secretory action of the mucous membrane is exploited. This itself is also which is happening in Parisravi Vyapat, in the Parikartika Vyapat. Okay. Then again, they have told something more. What it is? The drugs which increase the secretion by irritating the mucous membrane of the GIT. Right? This is what happens when we give the Vamana Aushadha or Virechana Aushadha. What happens? It irritates the mucus. It irritates the lining of the GIT. That is when the Vega starts. Second, it prevents the absorption of the nutrients, and finally it increases the gastrointestinal motility. This is what happens in Virechana. Am I right? Thus, Virechana is targeted to create a biochemical alteration as it modulates the fluid compartments of the body. Further, what happens to gut microbiota when Virechana is happening, or if at all a Vyapat is there? Further, changes over the E. coli colonization, Escherichia coli colonization, were reduced after the Virechana. This is what they have understood from the research. Okay, E. coli colonization were reduced after the Virechana, and healthy microbiota started improving. After the follow-up, which shows the effect over the gut flora dysbiosis and further induces a stability of the gut flora. So what exactly this Vamana and Virechana are doing? Visibly, what can we understand? It is actually helping the gut flora to improve. It is helping the gut flora to re-establish healthy gut microbiota to start getting produced in that part of the GIT. Studies have shown the changes in the metabolites across many pathways, such as the phospholipid biosynthesis, choline metabolism, and lipoprotein metabolism. All these are very basic metabolisms that happens in the cell cycle. But these can also be influenced because of Vamana and Vamana and Virechana Shodhana procedures. And finally, they have also given a conclusion. It's a very nice conclusion. I'll send you the article. The result suggests that Virechana karma and its pre-processing procedures both have fat metabolism correction activity against the metabolism syndrome due to insulin resistance and reduces the body weight, BMI, serum triglycerides, and blood glucose level. This decreases the fatty acid in the storage and the adipose tissue that can also indirectly increase the insulin sensitivity in the insulin receptor present at the skeletal muscles. Furthermore, it can be concluded that Virechana is effective in the management of obesity due to reduction in E. coli colonization after Virechana by correcting the gut flora dysbiosis. So I really thought this research and the people who have worked for this needs an applause. They deserve an applause because today what we don't understand is we give Vamana and Virechana. There is Vamana Virechana Vega. I also see Samyak Vamana Lakshana, Samyak Virechana Lakshana, Samyak Basti Lakshana. But I don't get the opportunity to visualize what exactly is happening in my Koshtha. We lack that experience. That is why at one instance we can just deviate and say what exactly Vamana or Virechana can do, how it is working, what is the mode of action of Vamana and Virechana. Even in the textbooks we get okay, like pages together of what is the mode of action, but we don't generally have kept this kind of ideology while writing that mode of action. I think even our textbooks have to upgrade in this regard. Samhitas have explained it in a very beautiful sense, but in order to visualize them, we have to also understand these research papers also. I hope you guys can also go see some research articles related to this. Okay, if you have any doubts, we can clarify or we will end the session today. रागादिरोगान् सततानुशक्तानशेषकायः प्रसृतानशेषान् औत्सुक्यमोहारतिदान् जघान यो पूर्ववैद्याय नमोऽस्तु तस्मै